I think most of you know me. I'm Mara Sullivan. I will say I'll use my new title. I'm the incoming CEO for the ARC of Massachusetts, starting on November 2nd. And I'm just so happy to have Nora Bent and Jose Lopez here today to walk you through this presentation. Nora's our new Director of Government Affairs and Strategic Partnership. And I think most of you know Jose. He's been with us for almost a year now as our policy officer. And they have an absolutely great handle on the survey and what's going on currently in the informal session for the legislature. And then we'll talk a little bit about our advocacy today that we're doing with the executive branch with the governor. So yeah, I'm very excited. I want to just take a minute to thank you all. Yeah, you can keep, that's good right there. This response that we got to our survey that was circulated just really over the last 2 weeks has been phenomenal. It's just amazing to me when we did this survey 2 years ago at the start of the last session. I think Katerina told me that we had, maybe like 150 responses. And I think we thought that was good at the time, actually. But we got over 500 responses to this survey. What's even more incredible is the amount of comments we had. So people weren't just going through and quickly, telling us their top priorities. They were taking the time to really write about their concerns and the things that they think the ARC really needs to focus on. And that's exactly what our goal was to really hear from you, to be able to truly amplify your voices. We need to hear from you. So that was the goal. And I think the other thing that came across just really clearly to me is that you're all very empowered. And that's another goal of the ARC is to empower our citizens. And this clearly showed throughout the survey information. So I'm so happy to have Nora take over here and fill you in a little bit more. And then Jose is going to go through some of the data as well. So Nora, why don't you take it away?
Sure. Thank you so much, Maura, and thanks everyone for joining. I think I've met some of you, but for those I haven't met, I've been on board here for about a month now. So still coming up to speed on some of the issues, but it's been great to meet so many of you and look forward to meeting the rest of you in the coming weeks and months. So as Maura said, before we get into kind of the meat of the survey, I'm going to give just a quick reminder and overview about the legislative process, where we are right now, and what comes next. So as folks might know, the Massachusetts legislature operates on a 2-year cycle. We are currently in the 193rd legislature, which runs from 2023 to 2024. And in January, a new session will begin for 2025 and 2026. So right now here at the ARC, we are busy kind of wrapping up the current session as successfully as we can. And I'll talk a little bit about those priorities in a minute. And simultaneously, we're working to prepare for the next session. And as Maura said, get that feedback and make sure our agenda for next session is incorporating that feedback and all of the other pieces that we'll talk about today. So right now we're in this sort of pre-January period of working on setting our agenda. And then this is the sort of overview of the process that we'll walk through beginning in January once bills are filed and begin to move through the process. I'm not going to go into super detail on this today because it can get kind of complicated, and I think many of you are familiar with it, but just wanted to kind of orient us in the process. So as I mentioned, we are kind of finishing up our current process or our current session right now. We are in what is called informal sessions in the legislature, which can be a little bit tricky. As some of you might know, in these informal sessions, any one legislator can stop a bill from moving forward if there are concerns or opposition. So the bills that are on your screen are the ones we're really prioritizing right now. They are really close and have a lot of support and no opposition. So it's our hope that we can get some of these done. These are kind of strategically chosen by our team of what we think we have the best shot at in the next couple of months. So thinking about archaic language legislation to finally get that archaic language out of our chapter law, supported decision-making, blue envelope, and a related bill on police training, and expansion of Nikki's law. I'm not going to go in the weeds on these because I think many of you are familiar, but just to flag that that's our current focus in addition to this priority setting. For those who haven't already, we do have 2 current action alerts. So if you haven't, please do contact your legislators. Maybe someone can throw that link in the chat so it's easy for folks to find. If not, I can do it in a minute. But those are on blue envelope and police training, and then Nikki's law expansion. All right. Moving on to our priority setting process. So what we just talked about is how we're trying to finish up the year and finish up the session. And now we're going to pivot to how we are preparing for the next session, which starts in January. Some of you may have seen in the last couple of weeks, we sent out a community survey, as Maura mentioned, and that feedback has really been incredible to go through. The survey closed about 2 days ago, so we are still very much analyzing it, but wanted to provide a really high-level overview of it today, which Jose will do in a minute. I want to just flag that our priority setting process includes more than the survey results. We are spending some time internally thinking about kind of how this current session or soon to be past session went for us. What were the lessons we learned? What went well? What could we have done better on? What was the landscape like? All of those questions factor in addition to what are other of our partner organizations working on and how can we kind of collaborate on that. What is the political landscape? All of these things really factor into setting us up for success to make sure that our priorities are, tied to what is top of mind for the community, as well as kind of feasible and realistic in the legislature. So with that, I will pass it to Jose, who will go through the top line of the survey results, and then we'll have some time for questions.
Great, thank you, Nora. As mentioned, we had over 500 responses to the survey, which is really fantastic, with 540 in total. And here's a breakdown of the responding person's primary connection to disability issues. Overwhelmingly, family members responded with 71%, or 381 respondents. Professional partners was the next largest group at 11%, or 59 respondents, and that's made up of direct support professionals, advocates, non-relative guardians, personal care attendants, service coordinators, program managers, and the like. Self-advocates were at 8%, or 41 respondents, which is great. And that helps ensure that we're respecting the mindset of nothing about us without us. We are grateful for each person who filled out the survey, and having a broad spectrum of respondents helps us to ensure completeness of issues to be considered. Here we ask you to rate policy issues to better understand which are the most important to our constituents. The scaling here is 1 if it's very important to you, and 5 not as important to you. So it's not saying it's not an issue that's important to someone, but from your perspective as the person filling out the survey, which is most important to you and which are lesser so. And so when we look at the healthcare, we can see that that was a top line issue, and these are done kind of in descending order. So healthcare would have received the most 1 scores as very important to that person. And the blue would then be 2, the yellow 3, the teal 4, and the orange kind of 5. And so again, all of these are weighted, with healthcare being at the top. Healthcare, workforce, pay rates, workforce training, and housing all received about 63% of respondents listing it as the number 1 item. So that's about 330 people. And so again, that's a grouping of policies which are really significant, and that people want to understand and see these policies through to become bills.
Jose, I have to jump in here. I was just
Please.
so happy to see that kind of the instinct that we've had around priorities came true in this survey. I mean, obviously the workforce has been the biggest priority to the ARC for, 6-7 years now. But to see that training came up as such a strong priority, this was actually something we're thinking about last session quite a bit. We proposed an earmark to the legislature to do a pilot around training, and we got it. So we're going to be implementing that earmark this year. But in general, going into this session, it was on my mind as a huge priority to try to figure out how to work in, whether it's through legislation or through budget. So to see that, it makes me really happy that we're really in line. But also, obviously, the healthcare piece coming through is so important. And you all know our initiatives around healthcare and health equity have been such a huge priority to the ARC, and they will continue to be. So just feeling very happy to see that alignment. Sorry to interrupt, Jose.
Oh, that was perfect. Thank you. And so on the next slide, please. So in this third question, we requested policy priorities that were not included in our list. And that was really an extensive response. So we had 168 commentary responses. So we definitely need more time to fully consider and analyze this information. But to generalize a few of the responses, there were quite a few on transportation, recreation activities, community inclusion, as well as ABA for adults, were some of the most frequently mentioned issues. Some of the other items that were in the commentary, again, we're just in the initial days of looking at it, but they probably fall into some of the categories we had in the previous slide of family support, day hab, and housing categories. But again, very grateful for all the responses. 168 is a significant amount, and many of them actually go into a number of different topics within just one comment. So again, much appreciative of that. For this side, the response to this question helps us to see your current view of priorities engaged in nearly 2 years ago, at the beginning of the 193rd legislative session. So, these are listed in descending order, with the top 5 priorities received at least 50% of respondents selecting very important. So this is a strong indicator of ongoing consideration of relevance of these priorities. The scale, again, is very important to you as a 1 and not as important to you as a 5. And as Nora mentioned earlier, Nikki's Law, expanding police training, and Blue Envelope, and support decision-making are still being deliberated on in the informal session. Question 5, and we did only ask 5 questions. Question 5 asks, what ideas do you have on legislation or areas of concern not included above? And again, here we received 160 commentary responses, which again was fabulous, and it's going to take us quite a bit of time to get through it all. But I just want to give you a few examples. One was legislative oversight for managed care groups is needed due to concern that overly restrictive practices and policies are diminishing care. Another is there are no regulations on food preparation safety. We need regulations that direct providers to follow USDA guidelines. So again, many of these comments were bringing up issues kind of across the entire, a wide ranging list of concerns. Another was the number of people going through SSI and SSDI challenges increasing rapidly, and it's putting financial strain on many Massachusetts residents. And there were a few comments regarding the lack of follow through with DDS. And I just want to pass one comment along too, which kind of cuts to the heart of advocacy, which is the person said, "Thank you for asking these important questions. I don't know what my son and I would do if we didn't have ARC resources." So, again, thank you for all. There were many, many comments, mentioning, of thanks, and we truly appreciate that. So now I'll turn it over to Maura to explain what comes next before we take questions.
Oh, great. Thank you so much, Jose. There is a lot of information to go through, and we appreciate those longer comments, but we really need to take time to go through them. We also talked today about how those comments will actually affect the overall survey results that you saw, the charts, because we want to make sure we factor those in as well. And of course, we couldn't really ask too many questions. We wanted to keep you engaged. So always feel free to reach out to us if you have priorities that you do not feel that we're addressing. I think what's hard is sometimes we are addressing those priorities, but we're just not communicating them enough how we're doing it. So please reach out and we can tell you what we are doing, what we're planning, and we always want that feedback. But this is just one opportunity to get it all at once, which is so great. So the deeper analysis is what we're going to be doing. And the other additional that Nora hit on a little bit earlier is how else we factor in. And, we have some wonderful internal committees at the ARC of Massachusetts, including our steering committee, which is made up of incredible experts and a broad range of parents and professionals and parent professionals. And it's a great committee for us to work with to set our priorities and finalize our priorities, as well as our government affairs committee as well. We also use Advocates for Autism in Massachusetts to review all of our priorities. And I think one of the really important things is for us to be doing our due diligence with our chairs of our legislative committees that worked on our bills and on our budget line items in the last session, and to make sure we're getting feedback directly from them around bills that went to study, which really means they weren't interested in passing them through committee, and that they need much further analysis. So those are the meetings that that Jose and I are having now with important leadership and chairs at the legislature. So that will factor in as well. And let's see, Nora, what else am I missing on our priority setting activities?
Yeah, I would just flag again, thinking through the agenda as a whole, what makes sense in a legislative piece, what is administration advocacy with the governor's office. We're kind of weighing all of that internally to make sure our agenda really makes sense and hits all of these bases.
Right. Okay. Yes. And also our outreach to other advocacy organizations as well, and doing those meetings with Nora now. So then the next thing you're going to hear from us is further analysis of this survey, and especially the written commentary, but also you'll be hearing from us about our advocacy directly with the governor about the FY26 budget. So we've had some meetings with administration already, and we're very close to having our letter ready to go to the governor that will talk about our priorities for the budget. We're going to stay, narrowed to the budget for this letter, since her budget is released in the third week of January. And we really want to make sure she knows our top priorities for that, which will include workforce rates and training and benefits. And you'll see when it'll be set up like an action alert for you to write the governor. So that should be coming hopefully in the next 3 weeks at the latest. All right. Was there anything else we wanted to hit on here?
I don't think so. I think that covers it. If folks have questions, we're happy to answer those or dive deeper into anything that we presented. And I'll stop sharing so we can all see each other.
And it was a lot of information thrown at you. But I really liked that, chart, because it was easy to see kind of, what really rose up as a top issues for everyone. And
How did he do that?
oh, and Jesse has his hand up. Go ahead.
Yes, just I'm wondering, you said you just begun to analyze the survey. I'm wondering, are you going to give us an update when you finished analyzing it?
Yeah, that's what I was saying. The next thing you'll hear from us is like further analysis of all those commentary. And where a lot of the comments fit into our existing priorities, and where we may need to table some of them, right? There may be some that we just aren't going to get to this year. But hopefully we are addressing the categories that had a significant number of people concerned. And, factoring in all those other things. So yeah, we have a great intern, and Jose and Nora and our intern will be digging through all those comments. Oh, I
Thank
think Robin?
Yes, hi. I just wanted to report on something that the self-advocates that I associate with have recently done. On August 9th, they had the opportunity to meet at our Lakeville Council on Aging with Representative Jake Auchincloss,
Oh,
where
wow.
2 of the individuals are engaged. They want to get married. And of course, there's, the penalty for that.
Sure.
And so we were able to present him with the face of the problem, these 2 individuals. And for the House Bill 5408, the SSI Savings Penalty Elimination Act. And while we were with him, he had his staff email down to Washington for them to put a packet together for him to consider co-sponsoring this bill.
Wonderful, Robin. That's such great
So
news. Oh my
it
gosh,
was
I
to show the
love
picture of the
hearing that.
people. Uh,
Wow, thank you for
Cheers.
sharing that. That's
you.
fantastic. And I will say, we did get a lot of comments on this survey that are relative to our federal advocacy efforts, which are not what we're focusing on for this budget and this legislative session in the state, but it's something we always focused on annually with our ARC of the United States as our national partner. And then I think some of we head to DC in the spring to specifically advocate for Social Security and other bills. So thank you for that. What a great news.
It was awesome. They did a beautiful job with the presentation. One of the gentlemen uses a voice output machine that he uses eye gaze to operate, and he did that, and like everyone in the room was astounded. He gave a lovely speech about how he can't save for a vacation, and how it impacts him to only be allowed to have $2,000 in assets. So I think they really were pleased, and we gave everything that the individual said. I had copies of all that and photos of the people and articles about marriage penalties to educate him on that issue. So we'll
That's
see.
great.
One more
I w-
person.
I would only recommend that you follow up.
As well, as a matter of fact, we have already had a meeting with Dana, his district coordinator, since that August 9th date.
Wonderful.
Just to go over that and some other information sharing just about how does DDS really work. And that
Good.
went very well too. So we're, developing a relationship with his local staff
Thank
to,
you so much for your
impact
advocacy.
Thank you.
for the people.
Right. Is there anyone else that has some advocacy news to share?
There was a question in the chat asking for more detail on healthcare issues. And so with our follow-up, it's exactly what we're going to do. Because if you remember the survey, a portion of it, some of the questions were just select this item. And so that's kind of where on question 2, you saw the slide that had healthcare at the top. That basically means that that item was selected. But in the commentary that we received, again, there were 168 responses for one of the questions and 160 for the other. So we'll make sure that we go through and try and categorize and give you a further breakdown about what those comments mean. So, but again, that does take a little bit of time.
Yeah. I would say what my instinct is, though, is just from looking through it quickly, is that people are concerned, about access, especially we're hearing about access to dental care and OR care. We're also hearing about quality and training needs, which Operation House Call has been growing and really trying to tackle some of those needs. But we also have a hospital training bill that we've been trying to get through that would do a broader scale training. So we will look more deeply to make sure there aren't any specific issues that we're missing. Okay.
And there's some other great comments in the chat, which we'll capture. And if folks have other things they want to add, feel free to throw that in the chat or ask any questions.
Yeah, does anyone else have anything else to share or any other questions? Oh, Commissioner update, good question. And I'm assuming you mean the DDS commissioner who's in our temporary role right now, and that is the commissioner is Sarah Peterson. And I think the word out is that, you know, they are doing a national search, and it will take some time. So we are working with Sarah Peterson. We have meetings set up with her, and also, you know, meeting with the Executive Office of Health and Human Services, who oversee DDS during this interim period, because it is concernable that we've had leadership changes. So we want to make sure that we're communicating as much as possible during this time. I don't know if anyone else has heard anything else new about the search, but I have a feeling it's going to take some time. All right. Thank you so much. And yeah, so we'll be in touch soon with further results of our survey, and keep your eyes open for all of our action alerts. And thank you again for your engagement.
Thank you.
Thanks, Nora and Jose.
Thanks,
Bye.
everyone.
Thanks. Bye.